Somebody came in?
And I broke it. Wait, no, not ready.
Here we go.
Alright.
So, can you believe this? Look at this technology.
Yes. Yes, I can. It's opening it.
Okay, so, is everyone there, or?
Yeah, they're coming right now. Sorry.
I kind of figured that. So while they're coming,
Okay, so should I wet the sponge?
yeah, I want to know what's here. I did a couple things. Let me just see here. What do you want to go over? Just the basics, the...
Yeah, the basics. But who should diagnose on the who would be able to advise?
Hold on 1 second. Let's see. Can you hear me?
Yes, I can now.
Okay. I'm going to put it up a little higher, maybe. Okay. Okay. Close that out. All right, so I have the device here. So you have it in front of you, I assume?
Yes,
Okay.
I do.
All right. One other thing I put in there. Do you see where it says there's a link?
Where?
On the side, maybe, on the...
Oh, okay, okay.
Do you see that or no?
Link?
I said here's a... I thought I...
I
There it
did,
is. There it is. You see it? You can go to this link. No.
no, I can't see anything.
Okay. All right. Well, it's there, and let me... It should be under, like, the chat public. Do you see that at all, or no?
Chat public?
Public chat.
There you go. Like
Do you
to
see
write?
it?
Or to
Yeah,
type?
to the right.
Okay.
You see it?
Yeah.
All right, and you see it says admin notice. You can go to this link for instruction.
No.
Okay. All right. What I'll do is I think I'll try to, I'll go through a quick thing. Tell me if everyone is there, and I can maybe play something and just go over this real quick.
Yeah, everyone is here.
Okay, let me see if I can share my screen, and then I'm going to go on to that link. Let's see what happens. Hold on.
All right. Is it drinking water? Yes.
Can you see this?
Mm-hmm.
Good.
I'll drink it after you put the thing in.
Huh?
Are we supposed to be just watching that?
For now. No, I want to be this one.
Let it all the way.
No.
You can just with the sponge and just
No,
squeeze it. No, you
You
don't.
don't squeeze it.
No, you don't.
You watched it? Fun.
It's clear. Quality.
Reverse hard that.
Right.
Console.
I've done it. It made me really special.
Yeah.
I'm like,
Happy. Happy came back.
Ron?
Mm-hmm.
Okay, so what
I
is,
just wanted to give you a little, that was kind of a little basic.
yeah, what does it exactly do? Like,
Okay, that's what I wanted to get into, in terms of the basics to what it actually does. The device, the good news is, and this is, I mean, within the last 2 weeks, really big news. I mean, this is 30, 40 years in the making. FDA just approved the device for the anxiety, stress, depression, and insomnia. So now the device is actually FDA approved. So what we can say and what you could tell people is that this is the only non-drug treatment FDA approved for anxiety, stress, depression, insomnia, etc. That is a major accomplishment for the companies, which in this class, which is called cranial electrical stimulation. And the reason it's called cranial is because it goes through, it goes through your head, and that's the cranial.
no.
Yeah, I didn't care.
So, let me see something here. There I am. So, so the big things that it does is that it actually increases serotonin, increases GABA, increases DHEA, increases most of the good neurotransmitter chemicals, and helps to balance what's going on in the brain. That's what it does. The same thing that's artificially done with medications, the Prozac, Effexor, etc. We are able to do that naturally through the use of the device. So that is the big accomplishment. And I'm not really saying here that, you tell patients and they believe that, okay, I could stop taking my medication. This should be used potentially as an adjunct to the patients and try to sometimes get them off. It's a great thing for, people who are possibly addicted to OxyContin and things along those lines, and then they may be going through a rehab or detox program and using, the Suboxolone or other methods. And then this is something to help really get them a little further, because why do most people go on and keep doing it is because they become anxious. I mean, even after the Suboxolone or those kind of treatments, the medication, the drug craving is really gone. The physical, but the mental issue and the anxiety, things that bring it on, are still there. So that's what it really helps. So we have a big effect with some of these people who are trying to get off of narcotics and medications. And we know in the work comp industry, one of the biggest things that we read about almost every day is the opiate addiction issues. So here we now have available to us a method, a way that has just become FDA approved to alleviate the potential of using medications as a first line of defense. So to recap, it's really all these good chemicals in our brain is what it does, and on the other side it decreases the stressor chemical, which is the cortisol we read about, that gives us the belly fat and all these other things that cortisol seems to do. And that's like from the when we see and encounter something, a situation that we're uncomfortable with, scary, getting in front of people to talk, and then your heart starts racing. That is the stressor hormone, which we actually, decrease. So all the good is benefiting, and all the negative, the cortisol, is being depleted. So it's basically comes out to be a win-win for all of us. Does that kind of answer it?
Kind of. So it's not just for people that have.
It's not for people. What was the question again?
Well, it's because Dr. Jose was telling me that everybody that has pain should get it.
Or
The reason why people with pain would get this, and is really the reason that anyone who has pain, chronic pain specifically, I mean, what happens? Let's take it even not chronic pain. How are you and everyone in the room when we get sick? And let's say we have a kid coming home and you're sick and you don't feel good. You're not the same mood. You're not in the same things. If they come home and says, Mom, Dad, can I go out and do this? Leave me alone. It's you might feel a little different. So your mood has changed. So this will change the mood and make it better. So anyone who's got pain or illness probably will become depressed. I mean, if you have pain for a long time, you're not working. Think about all these things. You're not working. You're not earning enough money. You can't pay your bills. All these things lead to what? Anxiety, stress, depression, and you probably can't sleep because your mind is now racing, thinking about how am I going to get out of this? Am I ever going to get better? So the same thing that they utilize this device, oh my gosh, in Iraq, in Afghanistan, with soldiers coming home, in the Veterans Administration, in the Department of Defense, because of all the same kind of issues that these soldiers come back, seeing things that we should never in our lifetime see. I mean, their friends being blown up, etc. So you probably come across patients who have maybe been hurt or been robbed. I've had patients who've been robbed, in a bank, a teller at gunpoint, and that kind of gives them some of those other feelings. So yes, it works with pain because of the fact that pain leads to all these other things. It also helps. Also, one of the chemicals it does is it actually increases the chemical to alleviate pain, which is the endorphin. So the beta endorphins are also increased, which would lead to pain relief. So all of these things are, part and parcel. They really work together. So all of these things is why we get, I think, such a big effect on certain people very quickly, because it's affecting everything within their diagnosis.
Okay, and the only part where you put it is right here, the temple?
Right now, that is. There are certain people who, there are studies that I've read about. Actually, one that I read that was done, I believe, in England. And I believe they put it here and here. And what they did is they did a study for people who are not really good in math. So they were really going after a different part of the brain. So if you're not good in math, they basically did some tests before and some tests after, and they showed improvement with the people on their math scores for putting in that session. The other thing that there's studies out there, let me go back. There are more studies on these type of devices than anything else on the marketplace, more than the TENS and the interferentials and all these other devices that are out there. So the studies on increasing, the beautiful thing about this is it increases focus and concentration. So even though we may be more relaxed, it actually can increase it, because when we have less things on our mind, we can focus better for ourselves. So, and you come across all of these patients in the, especially if you're dealing with anyone with, let's say, fibromyalgia, who have what they call the brain fog issues, so they can't remember their memory. This actually does help in that area. The other real benefit for those people, when you ask them, what is really benefiting? What do you feel with it? What do you experience with this? And one of the things they'll say, oh my gosh, I can actually get some restorative sleep. Not just sleep, restorative sleep, the quality sleep, not the quantity of sleep. And it really has an effect, as we all know, that sleep is a big part of the healing process. We have to sleep in order to get better. And the people who have chronic pain and these things who don't sleep have a hard time getting back in their life.
Okay, so when do we use it for sleep? Or when do we
when do you what's recommended here is really that you can utilize it at any time. One of the things that we do say sometimes before sleep, because sometimes people become more alert because of the focus. I'm ready. Me, when I first got into this, like 15 years ago, I got the device. I'm excited. Let me see, how it works, and I'm ready. I put it on right before bedtime, and I remember this. I'm going, oh my gosh, I'm going to get this great night's sleep tonight because I got this thing and it's good for us. And I'll tell you, I couldn't go to sleep. I was like ready to work. I was focused. I have ADHD, so I was like actually a new thing for me. I was focused. So some people actually, what happens is that they become more alert and focused, and other people, you'll see putting it on them, they'll start yawning. They'll start feeling sleepy. They'll want to go to bed. They'll want to get their rest. So everyone is different. So what we recommend is that you probably shouldn't do it less than, I was thinking how the wording for this, less than 3 hours before bedtime. Other people, if they find that it helps them go to sleep, it doesn't matter. But other people, it might make more alert.
You could put it on just before you go to sleep or go to bed and just have it on the whole time, or?
No, you really only need it for that 20-minute period of time. But what I'm saying is that everyone's affected, people are affected differently. So if a person puts it on and they're alert, then I would say that person needs to do it 3 hours before. So if they're going to bed at 10 o'clock, don't do it past 7 o'clock at night. Put it on at 7 for the 20 minutes and then go to bed at 10, you'll be fine. If you put it on at 10 while you're going to bed, if it makes you more alert, then you might have more difficulty actually falling asleep because you'll be ready to work. It's like, so it can help students. The other part was that they used to do tests with, you guys probably in the room don't even remember these things. There was something called a typewriter, and people used to type things on, and it used to have a piece of paper in it, and no printer. And so doing the skills as you learn, like texting, it's a skill that you learn, and people were able to learn quicker and actually perform with less errors after using these kind of treatments because they were in a better state, relaxed. So again, helping with attention, focus, concentration, and learning.
Now, with that said, what percentage would you say that this device or equipment actually works on the patients? What percentage?
Oh my gosh, that's a really good question. Statistically, again, let me try to put it in the right frame, because we have to look at the things that I learned over the years, which is really crazy, truthfully, is like, what do FDA use to say something is successful in medication? And I believe the statistic there is somewhere around 20%. So if 20-25% of the people get affected positively, like with an OxyContin, we're going to prove OxyContin for pain. It only affects those 25% of the people positively. Other people who are taking Prozac or Effexor, maybe they take it, doesn't work. That's why you can see people going through the psychologist or psychiatrist and getting prescribed. They'll try a drug that might work great on me, and they'll try the same drug for the same symptoms on you, and that one doesn't work on you, so they keep trying. So everything's different. Statistically, what we say is there's probably about an 80 to 90% efficacy on the device, meaning that it will. What I'm saying is that it will affect people at least by 25% or more. And as we go up to the 80, 90, 90%, it's probably still still in the 50% of the people will feel like 80% better. So let's say a person came in with a pain level of 10 or anxiety of 10. We should see at the end of the session that they probably would be down to a 7 or less. So that is actually considered a very good outcome. I'm not happy with it, truthfully. I want to see everyone get, to 0 and have no pain and none of these things. But if you compare to the medications, we're very much, and we probably actually, statistically, I think we actually outperform them.
So it depends on what the patients take, for example, like different pain medications they're on. So
correct. And let me throw in another point that you make me think of. One thing that happens sometimes with the device, where I've noticed that the patients don't necessarily get the same outcomes as I would like, and then I find out they're on, if they're on these heavy doses of a narcotic, I mean, it's very hard for the device to, it's hard for them to even differentiate. They're so zoned out, they can't maybe even just tell if it's working, if it's not working, things along those lines. So I always like to think that the best way to do it is that if they are taking some kind of pain meds or any kind of medication, that I would prefer, and it's not always possible because of things, I would prefer them to try to do the device when you're at the end of the medication right before. Funny story, I'll give you an example. I was at a conference once, and there was a couple of attorneys there, and one of the attorneys had chronic back pain and was on pain medications, and he was taking his pain meds every 4 to 6 hours. And he says, did this really work? Does the device really help? I said, well, I'm not going to say anything. The proof is really in the pudding. That's what's really wonderful about this device. You can really see the results on the patients. And it's a lot of time very quick, very immediate. So I said, here, go around, walk around, go to your classes, come back to me later. And he says, okay. Wow, I had really good results with this. I didn't have to, I was supposed to take my medication at this time, and now it's already, a few hours past that time, and I didn't need to take it. And he says, but, now he's giving me, the device back. And I said, and he said, now I'm going to take my medication instead. And people think that, okay, yeah, if I say to you guys the appropriate strategy to utilize the device would be to use it, twice a day for 20 minutes. But if somebody has chronic pain, because I deal with, and you probably deal with a lot of people with really the worst of the worst people, most chronic. And if they're on the OxyContins, and if we can get a result with those patients, and they can say, wow, when I'm on this thing, it allowed me to go X amount of time, and then I took my OxyContin because I wasn't using the device till later that evening. I would say at that point, I would recommend go use the device instead of taking the medication. If we can keep delaying and putting off and substitute a device that has no side effects, we're better. I think we're better off.
True. So how many do they have to use it every day?
The protocol would really be the appropriate thing. That's why it's really for something for home use. Most of the people who are using it in clinical situations do it with people, have them come in when they're treating, and then if they do well with it, and after they're done with their so-called limited visits, you're 12 or 24, then they'll say, okay, we had really good success with this, and in order to continue with this, then they'll make a recommendation for a home unit. Because really the protocol for most of the devices is that a patient should utilize it, every day, probably twice a day for 20 minutes to an hour a day. That's not always feasible in the situations that you and I are in. So most clinicians are utilizing it with their patient while they're in there, and then they record and see how they're doing, and then what they do is recommendations based on the outcomes that they get with the patients right there in the clinic. And they say, well, the patient came in, we came in, we asked them where they were at a 10 pain, when they left they were at 5, you know, there's been success with this. This is going to be helpful to the patient because it could help them, you know, have something at home that they can control. They don't have to be hospitalized. They don't have to call the doctors. They don't have to go in as often. So in essence, it could save money for insurance companies and employers, and so there's some other benefits on it that they would receive.
Okay. Now with this machine equipment, what are the side effects going from severe to?
The biggest side effects probably are you may get some skin irritation. So that's one that's there. You may get some dizziness. That's probably again, it's not very high. They're, you know, like, you know, less than probably 2%. Dizziness, skin irritation, something that people will notice or see might be they'll see flashing lights. That's not a side effect. That's just really normal with certain people, but it's something to be concerned about. They might get. The other thing they might get is some people may experience a little nausea. It's like, you know, if you take too much of something, if we have a little too much of our favorite drink of alcohol and have a little more and a little more, you might get the same way. So it gives you the same, so what it really means is that, guess what? If I feel a little too lightheaded and I feel a little too dizzy and I feel that, all it's telling me is I'm giving too much. So what do? Lower the intensity, bring it down, say, do you still feel that feeling? And when they say, no, I'm okay right now with this level, leave it at that level, and that's where they are. The intensity is like the same as your dose. So if it's 100 milligrams or 200 milligrams or 300 milligrams, it's based on the intensity of the device that you're using with the patient.
I have a question. In terms of the intensity, when do we know when to raise the intensity or just to keep it in a certain intensity?
I would say that, you know.
Okay, go ahead.
Go ahead.
No. That's it.
The recommendation is that we basically keep it like at a level of 2. You know, you go up to 2. If someone is really not on there and is on there for for a few sessions and not experiencing the things that I was talking about, a little lightheaded, feeling good, maybe feeling a little elation, euphoric, some of the words that come out of patients, just relax. Just, shoulders, start like this, and all of a sudden in the session you just see the shoulders going down and down and down, and then they start to, chill out and feel good and everything else. Then I might go up a little more, and in a future session, maybe I'd bring it up to 3. And if that's not working, then I'd go to the higher level, which is the 4th dial, and leave it at that. But if they have experiencing the things we talked about a little while ago regarding the nausea, dizzy, lightheaded, and let me go back. Some people actually like those feelings, especially people who have been addicted and like drugs. Hey, crank this thing up. I really like this. Oh my gosh, this is better than ecstasy. I mean, I really have people saying things like that on many occasions. This is better than, this is some good stuff, you know what I mean? So not to get off of the topic, but some people actually like that feeling. And other people, I'm going to give you the other side of things that I've noticed over the years, and it's really interesting that some people don't like those things. And the reason why, and what I usually can point out from my own experience, is people who like to be in control, I would say like the control freak, and they feel like they're getting relaxed, they start getting I don't like this. Why? Because, something is happening that they don't like. They like to be, in control. So if they start to feel relaxed, they don't like the device sometimes. So it's kind of interesting that, and I say to them, do you like to be in control? Yes. Yeah. The person with her says, oh, she's a control freak, and it makes sense because they start to relax and they don't want to let go. They want to keep on to what they have because they feel they need to be in control of everything. where the relaxation really helps you.
Now, with this, if our patients, some of our patients have pacemakers, would this affect that, or?
Some patients have what? I didn't hear.
Pacemakers.
I still didn't get it.
Pacemakers?
Oh, if it's a demand type pacemaker, it's not recommended. So if a demand type pacemaker is the specific one, I wouldn't use it with those patients. Pregnancy is a warning, but no study's been done. That's really for the legal aspects of it, because God forbid something happened to and had a miscarriage, then they would probably want to blame this. So we basically recommend not using it with people who are pregnant.
Okay.
And the other thing is, don't put anything near the carotid and things like that when you're having pulses that can stop blood flow or things like that. But really isn't much.
What about cancer patients?
Not a problem. Not a problem. Actually, that's always thought of, because in most other devices, the TENS and all these things, they always say don't use it on cancer patients.
Uh-huh.
The studies here have been, think about it. What's the worst thing and what's the biggest, my opinion, I shouldn't say, what's the biggest cause of cancer? I think one of the biggest causes is stress. And stress brings along all these illness and all these diseases. So if we can have a patient, here's actually, there was a study done at the University of Virginia, excuse me, with breast cancer patients. Mm-hmm. And one of the things that happens to cancer patients when they go in for chemo is they start getting nauseated before they go in for another treatment, because they know what's going to happen. It's called anticipatory nausea. So if you think that you're going into that session and you smell the hospital and you start actually vomiting because of the fact that you're just there and you know this is going to be the occurrence from this chemo. So they utilize this in a study to help those women going through and had better outcomes to avoid the anticipation, because all that is anxiety. It's a very severe form of anxiety. So it actually helps them deal with it. And one of the biggest things they say about any disease, cancer included, what's the best way to fight a disease? Have a good attitude, right? Have a positive attitude. Well, if this helps you get into a good mood and a positive attitude, doesn't it make sense that this would be beneficial to that type of patient? So that's why it's different.
So how do we know which pacemakers it would?
By the way, I can really go for that large Starbucks back there. It really looks pretty good. That. You don't have to put it away because I said something. It's okay,
That's okay. It's fun anyways.
So,
Sorry.
start. How do we do this?
How is this coming across? Is it coming across pretty well?
Yeah.
Let's make notes and try and get everything down, as fast as we can. But
Well, I'm going to tell you the beauty of this, I believe. The beauty of this at the end, I think it's going to be, it's being recorded, I believe, like on a YouTube channel kind of a thing. So if you want, you can actually, I'll see that we can save the link and maybe send it, and you can always review.
Okay. One more thing. Where exactly is it placed?
Okay, so you're going to have the band right above the eyebrows, right?
Mm-hmm.
And you're going to have the sponges right at the temple, right above the sideburn. So I say kind of like even with the top of the ear kind of thing is probably a good thing, because well, depending on the anatomy, but like if you can see, right around the sideburns, coming right around here. So right at this level here, you can see.
On top of the ear, right?
Well, say again?
Right on top of the ear, like the
Like
the
Yeah, right. Like right in the middle of, right at the temple,
okay.
right at the top of the ear. So you want the headband above. So wherever it really is, and you're just shoving that wet electrode. And I think people were concerned when I was down there, oh, it's dripping. It's okay to drip. It's only water. It's not going to hurt.
Does it have to be really, the sponge have to be really wet or just moist? So where, like,
No,
some,
it really should be wet. What we usually tell people to do to see if the device works is we'll soak it in the water, drop it in like we saw. Did everyone see that little video I played?
yes.
Okay. So we can put it in there, soak it, and then if we touch the sponges together to, not squeeze it all out, but just touch them together, get a little, a little excess water out of it. But it also, we can check, because now it's going to be conducting like it was on us, and we can check with if the lights start going on, so it's going to tell us if the battery's still good, if it's working. I think when I was down there, I forgot who it was, one of the people we tried had a lot of hair. One of the, was it a chiropractor? I can't remember who it was.
Okay.
And
Oh, you came.
I was, what's that?
You were actually here.
I was.
And one more
So
thing.
when I was,
You know how like there's black and red? Does it matter which way it goes? Like if the negative color goes to the left, right? It doesn't matter?
no,
Okay.
just as long as they're plugged into the black and the red. Doesn't matter where we put it.
Okay, alright.
It's really a very, very, I think, very simple, device to use. It's really, one button, you turn it on, put the water on. I mean, you really can't go that bad with it. I mean, you really can't mess up anything. There's not much to mess up. So, except maybe your hair. I mean, that's it.
Hopefully.
And then, you're looking good with that. I like it.
I want to try it on for myself,
I don't know if you can go in certain neighborhoods with that band on. I'm not sure, but
Yeah. Ooh, terrific.
Oh my god, he's gonna die.
I'm gonna
has
die.
anyone tried it there? I mean, have you guys tried it on yourselves?
This is
I
my
mean, I
first
tried
time,
it.
and I just see flashing lights in my head.
Yeah. That's what happened too.
So
All we see is like flashing lights. The people
See
that
flashing
we
lights in your eyes, kind of,
Yes.
when you close your eyes.
Yes.
Yeah, that's probably the stimulation of the, like the optic nerve is kind of in that area. So that's what's going to be firing off. It's kind of cool, actually. Some people like the fireworks.
Would it? No, I can. My vision, I can feel it like shaking, but that's really nothing, right?
No, I mean, again, if it's a little uncomfortable in a certain way, if it's too much for certain people, then we just basically say to, dial it down a little. Where is it at? What level?
I'm on 4.
Yeah, well, that's why we say go to 2.
I wasn't feeling anything when I had it down on 1.
Here's the interesting thing about it. Again, you don't need to feel something happening, although it's working. That's what the hard concept for some people to understand and to get. That even if it's on and it is conducting, it is doing something. That's why a lot of people like to crank it up to 4, because people in our society, we want to be able to feel something. It's like, with acupuncture, I don't believe in why. They put a needle in, I didn't really feel anything. I mean, what is it doing? Because I don't understand it. So it comes into that same kind of, I think, thought that if you don't feel it strong, because people are used to an interferential and a TENS device, and they're used to like their shoulders going up and their body being twitching, they know it's on, they know it's working. Here we want the opposite. We want to do it so it's more of a relaxing thing, and you don't need that kind of intensity, and it's okay to be at a lower level. How are you doing?
Oh, I'm good. I tried it, and I thought you would feel more of like a like a electric shock or
I don't think
some
that
type
that
of
would be safe.
Yeah.
stimulations?
Yeah, it's not very uncomfortable. It's pretty comfortable to wear. It's you know, and as he said in the video earlier, you know, you can go, you know, you can do work with it. You can do whatever you want with it. You really shouldn't use it with driving or heavy equipment, things along those lines. But to do your regular day-to-day, I mean, I've got clinicians who work in clinics who use it for themselves most of the time during their work because they say the doctor stresses them out so much that they have to use it all day just to be calm. So hopefully you don't have that same situation over there.
So what's the longest time you can use it?
Yeah, that's a good question too. I'm different than a lot of people probably. I tell people use it as much as you need it. I don't like to be put into any kind of any parameters. I don't like to use it once a day for 20 minutes, use it twice a day for 20 minutes. If a person is getting benefits out of it, and if they stop using it after the 20 minutes, and it lasts and gives them really good relief, and they feel really good for a few hours, let's say 2-3 hours, and instead of taking that medication, I say, you know what, put it on for another 20 minutes. It's not going to hurt you. There's nothing negative that's going to happen. So that's kind of what I try to tell people. Is everyone's body is different. Everyone tolerates medications differently. So you got to try to find out what works well and best for your own specific body.
Okay.
I don't put the parameters on that most people recommend. It's it's not always it's not the same for everybody.
You've tried this yourself, right?
Oh yeah, many times. My wife uses it pretty much regularly, almost every night.
Mm-hmm.
And my kids all have it in wherever they are. They've used it before. Tell you a funny story. My son a few years ago, probably 5-6 years ago, had it. Was going back to school. Stored his summer stuff in a storage facility. Went back to school. Took his stuff out. Was getting ready for his first test, and he likes to do it before his test to relax and feel good and get his mind clear. He couldn't find it, so he calls in a panic. So I had to, FedEx him another one until he found it, so he can, pass his test. He's now in medical school, so he's done okay. But he actually used this to relax and get that focus, concentration, and go into the test feeling more refreshed. On the same note, I mean, the soldiers in the military in Iraq, Afghanistan, because you don't get a lot of quality sleep and you're on, the lookout. So if you're only getting a few hours of sleep, if they utilize something like this, it might give them, the 20 or 40 minutes might feel like they had a few hours of sleep, which really makes a big difference in their life and their ability to perform, with their mission or whatever it is. So a lot of uses.
Now, are these all the things that comes with it? Just these? This right? This one? These right? Oh, okay. All right.
Any other? I mean, do you have more questions specifically, or?
Not at the
So
moment.
its use is just for stress, insomnia, anxiety, and depression, basically, right?
And chronic pain.
And pain. Pain is really in the same arena. So most of these people that you're what are most of the patients that you're seeing? What are their symptoms? What are you treating?
There's a lot of pain, mainly. And, I mean, we do have people that have trouble sleeping.
What about drug addictions? Would that be helpful? Would this machine help?
Absolutely. Absolutely. With drug addiction,
Okay.
yes, it's helpful because, again, some of the people who are addicted, I'm not saying that you're saying, hey, stop your medication, stop your drugs, and just use this. No, you have to be under doctor supervision and care, and hopefully maybe they would be put through one of these treatments like Suboxone to get off of some of the OxyContin, etc., or wean off. And it's easier to wean off. Some of these drugs are really hard to get off, and you need some help. And just as a thought that came into my mind many, many, many years ago, for people who know, I think it was Keith Richards and Townsend from The Who were addicted to heroin. And this kind of technology is what they used to get off of that addiction.
Huh? Okay.
So, you know, there's a lot of uses. I don't think we're really saying we're FDA cleared for addiction, but anxiety is definitely the part of the addiction that really does it. So yes, it does help, because anxiety is a major part of the addiction. And it helps people actually statistically. Again, studies are out there showing the benefit of people who have done this, you know, try to get off of things with, you know, on their own, not on their own, but without this device or without the help, and with it. And statistically, it is very significant of benefit for those who are doing it in combination. So I think we're going to be seeing more and more of that. Unfortunately, because of the news of the last week, we're seeing so much on depression, and you probably have seen studies that a lot of these depression medications have actually been, I believe, taken off the market. We have, you know, black label warnings on them that actually can increase the effect of suicide. So with Robin Williams in the news, you know, unfortunately with the tragic events there, this, I think, is going to get probably even more attention as a non-drug approach for people who, you know, and here's my thought, again, it's my own personal opinion. A lot of people, as a genius as maybe Robin Williams, you know, was, you know, when you start taking medications to treat certain things, it changes your brain. It changes who you are, and it may change how you think. So he may not be as creative being on drugs. So yes, it helps with depression, but then he's not who he is. And you don't maybe like that other person who's on the drugs, because you're more lethargic and you're more, I mean, you see them coming in there. People, personalities change on drugs, period. So it's a real shame. So maybe this is the answer to some of those problems. I'm hoping.
We're okay for now. I don't think.
You sure?
Yeah, I don't think we have any other questions. I mean, if I do, I'll shoot you a text or I'll call you, if that's okay.
Yeah. No problem. We can you can text, you can call me. We can do this again if you have more questions. If you want to send a bunch of questions and have them, you know, answered, we can do that too. So whatever, you know, you want, you know, we'll work with it. I mean, this is a good way to get things done, I think.
Okay. All right. Okay. Thank you, Ron.
All right. Thank you all for showing up.
All
All right. Have a great day. Okay. Take care.